Okay, good afternoon, everyone, and welcome to our webinar today on incident response and breach notification. I am Adam Bullion with QIP Solutions. I will be your moderator. By way of quick housekeeping, we are going to reserve some time at the end for questions. So if you can hold your questions for our presenter until that time, that would be great. You can ask questions in one of two ways. You can either type in your question by the chat function, which is on the left side of your screen, or you can raise your hand, which is under the mood function at the top of your screen. That will identify yourself as having a question, and then I can unmute you and you can speak directly to our presenter. As I mentioned, our topic today is on incident response and breach notification, and we're happy to have Stacy Scott of Stroh's Friedberg's Dallas office as our presenter today. Ms. Scott is the Director of Security Science at Stroh's Friedberg. She has significant experience in developing processes and technology that support risk-based scoring of information technology applications, systems, and network components, as well as drafting and improving security policies. She has a strong understanding of industry standards and regulations, including NIST 853, the HIPAA security rule, and the HIPAA breach notification rule. And she has previously served as HIPAA security officer for Baylor Scott & White Health. She holds a bachelor's degree of business administration and information and operations management from Texas A&M University. She's currently a member of the Information System Audit and Control Association, which is Healthcare Information Management Executives, and Healthcare Information Management System Society. Thank you for joining us, Stacy, and with that introduction, I will turn it over to you.
Okay, great. Well, welcome all. I appreciate you guys joining, and I really want to, I know we want to hold the questions until the end, but make sure you write those down. I'm happy to answer those, and I know we have limited time with each other, but I want to make sure this is helpful for you guys as much as possible. So basically today we want to talk about PHI, incident response plans, and breach notification. What's the difference? Why do we need an incident response plan, and what should we do about it? So let's get started with the necessity. Why do we need an incident response plan? A documented plan helps. It aids every security team and outside, but every corporation really, detect and mitigate security incidents, which can, of course, prevent costly breaches and, of course, the notification that we're all familiar with. Across all industries, it's stated, some research firms have shown that it costs per piece of data $194 to remediate the breach and notification and all of those things. In healthcare, it's a little higher. It's around $240 per PHI, per patient record, that it costs organizations to recover from a security incident. So having a plan is really important to avoid those things. Of course, public relation issues you've seen on the news recently. You've got large companies and large national brands that are reporting they've had breaches, and the consumer, how it feels. You might take a second thought of using your credit card or debit card in those areas, or you just kind of, it's known and it may hurt their brand a little bit. And the other thing that it can prevent is further damage to data that supports operations. So, if you don't have a plan to detect and mitigate, and we'll go through the steps in a minute, but recover, it may still, the incident and the issue may still be in your environment and may still cause problems and could bring down systems, could, prevent access to your EHR or different things that may stop operations from happening. And with that said, data remains safe, and there's no reportable event under HIPAA if you have it contained and eliminated, and you can prove those things. And we'll get into that a little bit more. But also, per the HIPAA security rule, incident response and reporting plans are required. And there's, good reason to have one, as I've explained, but there is a requirement in the security rule. So what is an incident response plan? What it is not, I'll start with that, is it's not the breach notification process, which generally involves your public relations folks or marketing, communications, your compliance and legal groups, HR, to really get them involved in how we're going to communicate this, what we need to communicate. An incident response plan is really the IT plan with business folks that should, A, identify the members that are going to be included in the incident response. A lot of times this team is ad hoc. They're called when an incident is noticed. So they're not meeting every week. They're not meeting monthly. It's when an incident occurs, they get called. They're the on-call specialists, per se. You've got your security experts, your IT experts. You've got usually someone from legal or compliance, and also communications. This one, in my experience, I can't stress enough how important to have someone responsible and who's good at and is accountable for communications out to your end users, to your executives, and then, of course, if it is a breach, to the, all appropriate breach notification parties. But during and after the incident occurs, so much, particularly during, so much confusion and chaos can go on. People hear one thing and then, you don't have a solution or an answer quite yet of what it is or how we're going to shut it down because we're still investigating. And then you get one-off calls left and right, and this team can't concentrate on solving the issue. They have to respond. So having someone responsible for communications only is very important, and I think people often miss that as not as critical role, but it in fact is. It really helps kind of shield everybody else from the chaos that goes on when an incident occurs. The IR plan should also have documented steps in detail, so what they're looking for, and we'll go over a good basic plan next. Incident classifications, so how do we respond and what do we do if we consider this a high risk, critical, or medium and low, all those good things. And then also tracking and reporting during and post-event. This kind of goes along with the communications piece I was just mentioning. How are we going to make sure we're taking care of all of the things that we need to? Who's on what, who's doing what, what's the status, and then afterwards, what did we learn, what do we need to do next time, or should we implement something into operations to prevent this in the future? So basic steps to an incident response plan. The first one is detection, so how the event is known to us. How do we identify the steps? This can be from different security tools like an intrusion detection system, IDS, or an intrusion prevention system, IPS. There's other things that can be involved, system and application or other network logs. The help desk, if they receive a call that there's an error or there's an issue or a system down, you can then discover that there's a security incident, there's a piece of malware that's preventing access or preventing like a denial of service, or escalation from a core customer group. So any of your business users, they may call the help desk or they may call you directly or one of these security teams or response teams, and that's how you can detect those things. So all of those need to be documented, where to call and what to do, and here's how we're going to get it. The next step in a good plan is assessment. So what is happening, who's affected, any analysis of those systems I just mentioned, to your IDS and IPS or any network system or application logs. Interview the participants. So if there's, people involved with something that happened, like a lost laptop, talk to those folks. What part did they play? What did they see? And then observation of incident effects. So that's more on the technical side again, where you can kind of look at, all right, get into the technical logs and see where is this piece of malware going and what has it been doing. The next step is engagement. Who can help? Who are the players? This is what I mentioned before. It's that ad hoc group called at the time of an incident. Representatives from legal, there's technical components, HR, compliance, but also representation from the administration side of the business. So your executive team may be on there for communication purposes, but what I've seen in the past is, someone out of the CNO office or the CMIO office has joined just to get the word out and to understand what's happening. We had a lot of help with that in my past. Next step, containment. How do we stop the spread and limit the damage? Do we shut down ports? Do we remove a workstation or a server? Do we see the device that's acting up, like a laptop? If it's somebody if a person, remove the person or the suspect if they are, doing something that is against the acceptable use policies that you have in place. Do you put in access control physically? Is there someone trying to get into the data center or to a highly critical area? And then there's, of course, access control from a technical perspective, your firewall rules, your IPS signatures, and antivirus, not malware type things that help block and clean and contain the incident. The next step is eradication. How do we eliminate the threat, which I just alluded to basically. There's examples of that would be virus removal actions, updating your signatures, and then cleaning up all infected laptops, for instance, or servers. The reconfiguration of devices, we need to do that. And then termination of person or a suspect if it's an employee that's, violating an acceptable use or policy or doing something that is, giving away your PHI. The next step is recovery. Rebuild or salvage the affected system, rebuild servers, reinstallation of an application, transfer of electronic knowledge. So take files off one computer and put them on another so they can investigate that computer, clean it up. Recovery is pretty self-explanatory. And then post-mortem, report and monitor, and then learn from the incident really and report on it. And then also, I think important here is to put in procedures to monitor for reoccurrences. How do we recognize this again? This is how we detected it in the first place. What will we do in the future to make sure A, it doesn't happen again, or that we notice it and can remediate it sooner if we don't have the tools or the resources to put in a blocker in place to prevent it. This can be, reporting can be in incident reports, root cause analysis reports, different presentations to get the word out, put in rules or triggers to your firewalls and your IPS and IDS, all your system logs, and then any procedure updates and press releases as well. So this methodology and this plan that I'm lining out here for you guys, it really relies heavily on the two-man rule. It's often referred to in forensic stuff, but what it really means is, seek validation from core customers. So, understand these things and make sure that we get validation before we put anything into place or say something totally, it's definite, this is what's happening and this is how we're going to take steps to contain, eradicate, and recover from it. So I think that's also important to note. So breach notification, what's the difference, what are the triggers, who needs to be notified, what's included. I think you may be familiar with this, but basically a breach, the definition of a breach, they have your firm go through, it's basically unsecured PHI that's been disclosed where it shouldn't have been. There are, how do you know if you have a breach? There is a guideline on how you do what they call a risk assessment of at least 4 factors, and that's to help determine, do I have a breach or not? Those 4 factors are, the nature and extent of the PHI that was involved, types of identifiers, was it a patient name and, their diagnosis? Was it a patient first name and a medical record number and, something else that maybe really couldn't, it's not too much detail, but it's enough to get you more further information. The second factor is who's the person or entity to which the disclosure was made and they were unauthorized. Who is that person? Is it, you know, another employee? Is it another physician or clinician? Or is it an outside firm or someone in the black market looking for, you know, personal data to sell? The third factor is whether the protected health information was actually acquired or viewed. So it may be out there, but did anybody actually take it and look at it? And can we prove that they did or did not? The fourth factor in defining a breach and knowing that is to the extent to which the risk has been mitigated. So that goes directly back to your incident response plan and your documentation. If you have a good incident response plan and you have good action on it and good documentation, you may not have a breach if it's a smaller, you know, incident and it was disclosed to an employee, another physician by accident. They didn't view it, and we have steps in place to say, you know, here's what we're going to do and here's how we respond to these situations. That also counts in the eyes of the government. So what needs to be included, you know, and who needs to be notified? Basically, it's really, you know, what was the situation? What was the PHI? What's the volume of PHI? What was the, you know, they'll ask for specifics, but they ask for what type of PHI, who's affected, how many people, what device or what, how did it happen, and what are you doing about it are the big main things on how you notify the government or other folks of here's a breach notification. And different states have different laws, so we could have a whole nother probably 2 or 3 webinars on, you know, what's included, but if you have questions, maybe we can probably go into some of those. But who needs to be notified? The first requirement is around individual notice, so the patients. Notifying them, hey, it may have been that your information has been, you know, your personal health information has been disclosed to an unauthorized person or entity, and you know, here's what we're doing about it. And a lot of times that involves offering free credit, you know, monitoring, and or you know, then might require action upon them to change a password or, you know, whatever it may be the case. And those individual notifications must be provided no later than 60 days after discovery of the breach. So a lot of times people get nervous here as well because a breach may be in your environment, an incident may be in your environment for 3 months, but you don't notice it until, you know, 3 months into it. And then from that point, when you discovered it, important to document it as a part of your IR plan, that you have 60 days from that point of identification. That's when you detected it. It's not from how long it's been in there. You'd hope that those days would be closer together, but sometimes they're just not, unfortunately. But that's how you learn and get better, and you have, you know, that in your incident response post-mortem reports as well. The other people that need to be notified, if it is more than 500 residents of a state or jurisdiction, you have to give the media notification. Usually a press release does this, no later than 60 days, again, following discovery. And then if it affects 500 or more individuals, there's a notice to the Secretary of the HSS via their website, again, no later than 60 days following the identification of a breach, which, you know, can be very, there's people on the list. There's a breach out there, there's a website out there that talks about, you know, these are the companies that have had a breach. It talks about very limited details, but it gives you, look, it was a laptop was stolen, or, you know, this was, you know, this is what the case of what happened. So this was that's basically who needs to be notified. The other big thing, though, is in determining what triggers a breach after that risk assessment, those 4 factors, is they have exception criteria that really cover, you know, what is not a breach, and there's 3 of those. And really, it's unintentional access, If you can say, someone who has unauthorized access was in good faith trying to do the right thing, but, accidentally gave it away, but here's what we're doing about it anyway. The second exception is an inadvertent disclosure, really around, it's usually around organized healthcare arrangements in which the covered entity participates. And the other one is, you can, in good faith, prove that the person who had access to the PHI would not have been able to retain the information. So the disclosure was made, but they wouldn't have been able to see it or access it. And a lot of times people kind of call this the encryption exception. There are guidelines around that as well, but if you have a lost laptop, which is very common, or different things, mobile device, if you can prove that that device has whole disk or full encryption, then it is not a breach. It's kind of a safe harbor per se for breach notification. So with that, that's the end of, I want to leave time for questions for you guys, if you have any. But a little bit about Strauss Friedberg. We're a leading provider of incident response and security science services. We have a bunch of scientists and engineers on our team, and we have commercial and government experience. Myself, I have a strong healthcare background. We have quite a few others in our firm that have the same. We work a lot on proactive and security science matters, and the difference I think that we provide is we look at, are you in compliance with these different areas? Are you, we assess your organization, but we also talk about effectiveness. A lot of people can have a plan. A lot of people can have documentation and, policies and procedures, but really getting to understand your client environment and your IT environment helps us really, with our experience, kind of determine this is where we think you need to focus first, and then go down this line, and then really provide some value to you guys around, what's most important and are you effective or not. So enough about that. Thank you for today, and Adam, I'll throw it back over to you.
Okay, thank you. Great information. I have a few questions here. One is on what would you say is the value of practicing the incident response plan prior to an actual incident? Is that something you recommend?
Yes.
Or?
Yeah, absolutely. That's a great question. We hear about it with, continuity plans and disaster recovery type things. Same thing here. If you can do a tabletop exercise just to kind of get everybody together. The other thing that I've seen people do is templatize or develop templates, I should say, for how we're going to communicate and what and when. But I think it's always good and very valuable, actually, to practice, kind of do a mock security incident so people know when and where to call and whom to get engaged. A lot of times there's the question of, is it an incident or not, and do we need to call this ad hoc team? So I think practice helps with that a lot. Okay,
great. Another question we received is for smaller providers, someone who might not have a dedicated person in legal, maybe they have an IT person, maybe they're part-time. It seems like there are some inherent difficulties in sort of putting that incident response team together. People might wear several hats within that team. One person might wear several hats, whether it be legal and communication, anything specific. And I guess sort of the question that was directed to me was, should you allow somebody to wear several hats within that incident response team, or would it be better to have third-party relationships set up too in that event? Or is it okay for somebody to have a couple roles within that team?
I think it's a really good question. I think it's okay for people to have multiple roles. What I would suggest is, and something we didn't really hit on too much in this discussion, but incident classification. So when you have a more critical or priority one, triage basically incident where patients are affected, there's power outages, there's quite a bit is happening, I would maybe get outside sources on those where everybody fills an individual role. But if it's something that's a little lower priority, it doesn't have a direct impact on business or patient care or patient safety, any of those things, I would suggest that maybe wearing multiple hats for small organizations is acceptable.
Okay, and I have one more question that I've already received. So if anybody has some more questions, take a few more minutes. The last question that I have received so far is about breach notification for if the PHI the person with the affected PHI is a minor. Does that immediately go to their guardian, supposedly?
So
it would just go to the guardian, not your right. Okay.
The guardian will receive notification. Yeah, sorry.
Right.
Mm-hmm.
Okay. Other questions? Well, while anybody contemplates that, and we'll have a last call for questions, I will let you know that we have been recording this, and as normal, everyone will receive an email with a link. I'll post it on our website, as well as we'll have a copy of the slide deck for everybody that will go out probably this afternoon, if not early tomorrow. And we have our next webinar lined up. As you can see, it's on the 29th of October, which is a Wednesday, 1 Eastern, and we'll be looking at meaningful use investigations. Rich Sanders, an attorney out of Atlanta, who does a lot of work with meaningful use investigations, will be our presenter. So any more questions? Okay. Well, Stacy, thank you so much. I really appreciate your time. And thanks to everyone who participated. And we'll end it there, 1 minute early.
Thank
you.